Hello, everyone. Welcome to today's Infuse session. I'm going to give it just a few more minutes before we jump into all of our fun stuff today, just to let folks trickle onto the call because it usually takes 2 to 5 minutes or so. But thank you for those of you who are ready and waiting. I appreciate that and your punctuality. See some familiar names. See some unfamiliar names. Cool. That's two. Welcome. If this is your first time, I'm going to chat just a little bit about myself, provide some history and introduction, and then we'll get into the educational portion of the call after that. And then the most exciting thing, maybe not the most exciting thing, but we'll do a prize drawing towards the end. So we got some fun stuff ready to go for you guys today. So we'll just hang tight another minute or two, and then we'll get started. Those of you who are here, even if you've been here for before, if you want to go ahead and just pop a nice little welcome, not welcome, but introductory message in the chat. Just say your name, where you're from, what you had for breakfast today. Get to know each other a little bit. Hi, Caitlin from Chicago. Overnight seeded oats with berries, lovely, and egg whites. Oh, very nice. Very nice. Hi, Joni and Tiffany. I think you both kind of came in at the same time. Tiffany from Tampa. Breakfast was homemade meal replacement. Very nice. Bananas, berries, chia. Ooh, there's a theme with some chia today. Walnuts. Very nice. I just did not here, sorry. In my brain, there's a theme with chia. Sorry. I just did um, a chia seed and berry yogurt bark recipe for one of my clients recently. Joni from Philadelphia, oatmeal with blueberry, walnuts, and egg. Oatmeal with strawberries. Lots of oatmeal too. I also had oatmeal. I make a breakfast pancake with oats, banana, and an egg. And I mix it all up and mash it, and I just pour it into a pan and it becomes a pancake. So that's my weekday go-to breakfast. Protein bagel with cream cheese. I love it. Oh, you met us at the SNAP conference. That's awesome. I'm so glad you were able to join a while back. You know, it was a while back. It doesn't feel like it, but at the same time, it does. I don't have a great concept of time, so you're all good, Alexandra. Whole grain toast with almond butter, honey, bee pollen. Ooh, nice, nice addition. There's some chia, hemp seeds with fruit. Oh, this is making me hungry. I should have had a snack before the call. Oh no. Oh no. This is wonderful. So those of you who just joined, just go ahead and say hi in the chat, pop in your name, where you're from, and what you had for breakfast today. That's what we're doing. That's what we're doing today. All right, guys, I have 3:05, so I will not keep you waiting any longer. Again, welcome to Infuse. I'm happy to have you here. My name is Melanya. I'm also a dietitian, and this community is for dietitians and nutritionists in culinary medicine. I say dietitians, nutritionists, not just those in the United States, but anywhere, folks from anywhere in the world are welcome to join. And there's kind of different terminology depending on what country you live in. But most of them are called dietitians or nutritionists from what I've seen. So if you haven't already, we've kind of already done our introduction, so I won't spend too much time on this, but I do want to get to know you. And this is in addition to the breakfast question I just asked. But you've already introduced your name, where you're from. I want you to share a little bit about why you're here. What are you looking to gain from these calls? What are you working on? Even if you're just like, I want to hang out and learn things while I take my lunch break, that's cool too. And then I'm also curious, do you already practice culinary medicine, or are you just getting started? Kind of where in that journey are you? Is this just a thought in your head? Do you think this is something neat that you would like to try or integrate? Or are you already in? Are you already way in, up to your eyeballs, and you're looking to grow your program, expand it, enhance it, increase your impact? Where are we at, guys? Share it with me. Lay it on. Oh, we got someone from Oahu, Hawaii. That's exciting. Renata, good to see you again, Renata. I remember you. And Brenna, yay. Idaho. Wow, we got people far and wide. This is wonderful. Lauren says she's hoping to integrate culinary medicine into her private practice. I got you, Lauren. Today will be a good day for you. Honestly, every day is a good day for everybody. But that's a big piece of what I like to help people with is not letting lack of a kitchen or an organization behind you stop you from proceeding and integrating culinary medicine. No, there's definitely ways to do it. Just getting started, Tiffany is looking to learn and continue to build and share with her communities. Wonderful. Sarah's working on developing a new teaching kitchen program for the community, and she's an advocate for a culinary medicine minor. Oh, that's great. Education is where it's at for sure. Training our future dietitians. I love it. Here to increase knowledge and culinary medicine skills, improve your program. So enhancement here, very good. Already provide cooking and nutrition classes. So you already do some. Wonderful. Welcome, Erin. Joni's also working to build a culinary medicine practice, dabbled a bit here and there, and wants to move forward with a one-to-one practice. It's very rewarding, very rewarding. So many conversations and barriers and challenges to people eating healthy come up when we're in the kitchen, because that's when we interact with food. We don't always get the opportunity to address everything in like a traditional office or even telehealth one-to-one setting, right? Because it's a lot of these barriers and questions are context-based. So if we get them in the kitchen, even something simple, low key, like variations of toast or oatmeal, as everybody here seems to eat oatmeal, which I'm not too surprised. Even doing something simple like that can reveal some things to us and bring up nice topics of conversation where we can help our clients overcome these challenges and really establish the behaviors that we and they are wanting to. Caitlin already has an extensive culinary background, go you, Caitlin, but wants to learn how to integrate it into the dietetic role. Wonderful, wonderful. Liz is a public educator and trying to help give tips to my people. I love it, Liz. Yes. Renata also already practices culinary nutrition, and it's her third year teaching a year-long cooking class to high school students. That's so cool. Start them young. Give them at least some of that exposure, right? So they know it's a thing that exists, first of all. And then really planting those seeds, right? You don't have to go, we've talked about this before, we don't have to go all the way to the end goal right at the beginning, right? Even though we see the end goal, that's where we want our people to be, that's not where we start. We start where they are. And sometimes that's just planting seeds. And as they grow and go through life, those seeds will bloom and blossom and develop into something that helps them. Sandra's a former pastry chef. Alexander, I see a lot of pastry chefs in particular entering this scene. I think it's very interesting. I would love to I would love to study that and see what that underlying connection is. That one in particular, that like specialty. So I do find that interesting. Oh, you're working on your own little apothecary. That's cool. I love it. I love to see what you guys are up to. This is like the joy of my day. I hope you know that. This is wonderful. Alice volunteers with a kids tent at the farmers market. Awesome. Also starting them young. I appreciate that. And wants to learn more about blending culinary medicine and foods into her work. Wonderful. Oh, I cannot say your name. I'm so sorry. Ikaika? Miss Molina. Maybe I can say that one. I'm so sorry if I butchered your name. Is also a chef, works in healthcare clinic. Okay, very good setup with obesity, diabetes programs. Awesome. You guys got some really cool things going. And even if you don't yet, I'm sure you will. Otherwise, you wouldn't be here. I'm sure it's going to come to fruition. I'm going to send you all of that wonderful, bountiful energy. All right. This is great, you guys. Thank you so much for giving me some context. It helps me to help you when I know who I'm talking to. And that way I can tailor some of this education to your situations and the scenarios you may encounter and to the barriers you encounter and help you overcome some of this stuff and move forward with your own programming. So I do appreciate that. Go ahead and keep popping things into the chat as you think of them, or if you're still typing and you haven't gotten there yet. um, and I always take a look at the chats afterward just to make sure I know my people and to see where I can be of the best service here. So, all right, a little bit about me. A few of you I've seen before on these calls or know outside of these calls as well. So I do apologize. You're going to hear me talk about myself a lot, but I'm going to try to keep it brief. But I do feel the need to introduce myself if you're not familiar with me or haven't talked to me before. Just sort of like, who is this lady telling us things? I've been practicing culinary medicine myself for 12 years, though kind of in the back of my head, I give myself a little bit more credit than that since I started quite young. I'll say more about that in a minute. But I would say my most notable accomplishment is the creation and leadership of the world's largest teaching kitchen program at a single integrated healthcare system in the world. This would be the Department of Veterans Affairs, where I served over 200,000 participants annually. Not just me, but me and all of the other dietitians involved in this program. Let me say that too. But I've helped through that program and my own practice currently. I've helped over 200 culinary medicine programs get started, so get off the ground. And served at least 40,000 clients personally through all of my classes throughout these years in teaching kitchens. And then provided support to over 500 different dietitians. So not just program fruition, but this includes private practice dietitians, other dietitians wanting to start or enhance their culinary medicine practice. So I do use the words practice and program kind of interchangeably. A program imparts like maybe a cohesive or bigger thing, but culinary medicine doesn't have to be a program. It can just be a practice. It is an approach to nutrition care. You are leading them into this exploration of their own drivers of behavior change. You're creating scenario-based learning. You're walking them through the decision-making process of things. So culinary medicine isn't just for teaching kitchens, though that is the most common and a wonderful, wonderful outlet for it. And a very sensible outlet for it. But you can do culinary medicine without a kitchen too. I might talk about that on the next call in, what is it, September. We're August now, just kidding. But I do have something else for you lined up today that I think will still be equally as valuable. Why am I here? Simply put, it is my dream to see culinary medicine or interactive nutrition education, as it used to be. I used to call that before the term became a thing. I want to see this become the standard of care. That is truly why I do what I do. That is why this call exists. That is why it will be a free resource forever, because I don't believe in gatekeeping information that people can benefit from and should know and need. I want to see this become the standard of care. I want dietitians everywhere, even if they choose not to do this, I want them to know it's an option and know it's a thing they can do. And I want it to be accessible in every way. I want it to be accessible for us as healthcare providers. I also want it to be accessible for the people we serve. I would love to see this in every primary care practice and healthcare facility everywhere, like everywhere, worldwide. This is what I'm going for. I didn't start with much of anything. I got my RD and I didn't even finish my master's at first because I was bored and I just wanted to go make money. I went back and got my master's after that, but I really didn't start with anything. I wasn't a classically trained chef at that time, and I just liked cooking, and I kind of had it as a hobby. I remember trying all kinds of wacko things in my little apartment kitchen in college, but I didn't really start with anything. I made it happen because that's what I saw the need for. I started practicing, I started in inpatient and dabbled in some outpatient, and I'm like, this isn't what I need. This isn't the best way to help these people, right? I need to really connect with them. I need to be in this space with them. I need to help them over these barriers and hurdles that I see. And through that, I ended up building my own program and then became the national lead in 2018 and successfully scaled that program for the VA across the nation to over 130 medical centers. And now I want to see it scaled globally. I no longer work for the VA. I do my own thing. And I'm a consultant, I'm a guide, I'm an educator, and I also have my own private practice teaching kitchen. So I want to share all of this experience with you guys so that more of you can go out and do this and my dream can become a reality. So that's my exciting little moment there. If you want to learn more about culinary medicine, you don't know where to start, you feel a little bit overwhelmed, but you know this thing is for you. You've already started, you want to enhance it. You've had a program land in your lap and you're like, okay, what do I do with this now? You want to just feel more confident in yourself as a facilitator, or you want to start to integrate culinary medicine into your practice, you, my friend, are in the right place. This is where we will talk about all of these things. And to that point, if there's something, I have lots of content planned, don't worry, but if there is something that you want to know specifically, please always feel free to shoot me a message. I'm very open to feedback and I want to know what you want to know so I can help you with it. So go ahead and shoot me a message. It could be an email, it could be a LinkedIn message, whatever. It could just be a comment in the chat here. Please share those things, and I will bring it up in a future call and make sure it does get addressed for you. So a little bit more background on me. I've only been practicing for about 12, maybe actually 13 years now. I should update that. In culinary medicine specifically, but I argue I've been doing this for about 30 years. Hence a picture of me when I was a little kiddo, cooking up things in my kitchen and giving people the side eye for interrupting my process. So, and then I found, like I said, this was a hobby of mine. I just was really into it and it just made sense. I almost went into food science because I was so fascinated with cooking and the kind of the chemistry behind it. And then I realized my favorite thing to do is talk to people, not work in a lab or study things. I find research fascinating, but I like to be the communicator. I like to facilitate those light bulb moments for people. That is what I get my joy out of. So I pivoted and became a dietitian instead. And here I am today, helping you, serving other people still with my own practice, and making this dream of mine a reality is and taking it as far as I can take it. We'll say it that way. All right. So I'm here to share knowledge, skills, and perspective. I find perspective is a big one, not only with my lay clients, but in with you guys, dietitians, other healthcare professionals. We have self-imposed limits on things. Our own mindset is sometimes what holds us back. So that's a big part of the space that I work in particular. I help shift that perspective so you can see where the opportunities are. You can see what you are capable of, not what you're lacking, right? We each have a unique skill set. We have our own talents. We have our own power, so to speak, and we can harness that. Not every teaching kitchen or culinary medicine program has to look the same. And that's part of the beauty of this entire field, is that variety. There is something for everyone, and everyone is for someone. So what I'm really passionate about is helping you align with your strengths, overcome whatever is standing in your way to integrating and implementing that culinary medicine in your practice. Oh no, my photo didn't load. Well, I had a QR code here. Whoops-a-daisy, that didn't work. I'll probably try to fix this, but I think my assistant Rowena can pop something in the chat for you. She can pop a link in there, and that way you guys can access what the QR code was going to show you. I do apologize for that. I've shared a little bit about what I do, and I've teased this to a few folks, but I am going to open a culinary medicine mastermind. This is going to be a year-long program, 12 months commitment, and I'm going to open it in January 2026. So you got some time to roll around with it in your brain. Enrollment will start in October. I'll probably offer some sort of like early bird, you heard it first, incentive. And then as we get closer to January, the price will go up. But thanks, Rowena, for posting that link in the chat. I appreciate it. Did you post it? No. Did you post it? Do you think you will offer? I'm looking at your question. Sorry. I just tried to read 3 things at one time. Will I offer this program more than just in 2026? Yes, I will. I do intend to continue this. But I will go ahead and say this will probably be the lowest price point it will ever be at, since this is the maiden voyage. And as I continue to offer and refine it, it will become slightly more expensive. If that is not a problem, then I just need you to know that. That's all. That's fine. But yes, I do intend to offer it again. This is something, this is part of how I see myself achieving my dream and my vision is really getting, I like intimate work. We really get to uncover things. I get to help you kind of step by step in a sense. With that year-long mastermind, it'll give me a lot of close working time with my people, and it'll be a pretty small group mastermind. I'm going to keep it limited to maybe I'd say 12 spots maximum. I'm still playing around with that number. We'll say 8 to 12. It's not going to be big. So it's going to stay intimate. That way I can make sure I have the capacity to show up and serve you guys and help you through your challenges. Thank you, Rowena. Okay, so that Google Forms, that's just the wait list. So if you do have an interest in this, even if it's not for 2026, go ahead and pop your interest in there. And that way you kind of stay on my radar and I can send you the updates and the information about it and let you know when enrollment opens and such. So appreciate that. But yeah, it will start January 2026, and I'm even planning, there will be a live in-person retreat as part of it. Maybe retreat's not the right word, but we'll have a get together where we all meet up in person and we do some live teaching kitchen scenarios so you can really flex your facilitation skills and practice what you're going to do in your own practice in some real time, get feedback, get guidance, feel good about it, feel confident about it. So that's going to be some of the gold there too. I'm very excited about it. I hope you are as well. And I'm really bummed my QR code didn't work there, but you have the link in the chat. And for those of you that might be watching this as the replay or recording, I'll go ahead and fix the QR code in the recording so it's there for you. All right, that's my exciting announcement for today. Oops, I went the wrong way. Whoops, there we go. All right, more questions for you guys in the chat. Let me pull that up there. Is it really necessary to sign in with Google? Oh, dang. It shouldn't be. I'm so sorry, Renata. If you want, I can just, I can send it to you in an email after this, and that way I'll just send you the questions. You don't have to do the form. I can put it in the form for you. That's strange. You're patient. Thank you for your patience. I'm skilled in many things, but I am not a tech guru. I can do okay, but I have my limits. Alexandra, great question. Is the mastermind, I'm going to go back a step because I'm still talking about it. The mastermind is virtual. It's telehealth throughout the whole year, but there will be kind of a culmination of the workshops and lessons along the way and an in-person standalone event. So we'll work together remotely through most of the year, and you'll have plenty of planning time. The retreat/event where we come together in person and workshop some live culinary medicine facilitation skills. That will be, you'll know about that ahead of time, and that will be included in the package price for the mastermind. The only thing you'll be responsible is like getting yourself there, your travel. But the room and board will be included. Yeah. So that is the one in-person portion. I hope that was clear. Sorry if it wasn't before. So that is the one in-person event, but the rest of the mastermind will be a series of Zoom calls essentially, and worksheets and flowcharts, no, not flowcharts, but materials and resources to help you in whatever capacity you need. Good questions, you guys. Good questions. This is the time for it. I'm glad you're asking. Okay, now I'm going to move forward. So my next question for you, and this is kind of, I did ask this a little bit, I guess I didn't ask this one, but I'm going to ask it. What do you envision for your culinary medicine practice? So I just shared kind of my big vision, my goals, my dreams, for my current practice. What do you want out of this? And don't like, there's zero judgment here. I'm sure you want to change the world too. I feel like to some degree, all of us do, which is another reason why we're in this field and we want to help people. But what's going on? It can be your big goal. It can just be your next thing. Like, what are you thinking? Like, what do you want to do this year? What do you want to do in the next 5 years, 10 years? What does that look like for you? What would you love to create with your culinary medicine practice? If you can articulate that and you kind of have that in your mind and describe it, I would love to see you guys pop that in the chat. Your dream, your vision. Give you guys a few minutes to do that. My next question is, what is your biggest struggle or barrier right now? And my thought in asking this question is, what is keeping you from taking a step towards that vision? That's really what I'm after. What's keeping you back right now? What's the hesitancy? What's the fear? What are those intrusive thoughts saying when you think of your vision? What's keeping you from taking that step? This is a deep question, so I'm going to give you guys a little bit of time to just percolate on that. See if you want to come up with some answers. Even if you don't post it in the chat, I would still hope you think about it, but I like seeing your responses too. And I'm interested to know what you vision for your practice. All right, Joni, thanks for being the first to volunteer there. For people to realize that healthy cooking doesn't have to be hard or taste bland. Yes, yes. We're just really good at making things harder than they need to be. All of us, all human beings. We're good at that. And to help others feel confident. Whoops. My chat just updated as I was reading that. Help others feel confident in the kitchen, confidence, big one, in eating more healthy, real food. I love it. I couldn't have said it better, Joni. That's wonderful. More confident in the kitchen. That's a big one. Touching on, it's not really a knowledge issue. It's not even a skill issue sometimes. They may even know how to do it, but they just don't believe they do, or they don't believe they're good enough at it, right? And how do we get good? We practice. But if they don't have confidence that they can get good, they're not going to practice. So that confidence is a huge piece, a huge, huge piece. Wonderful. Oh, Tiffany, that's okay. I can still read it. Doesn't matter. It made it in. Curriculum or guide. Ooh, in terms of biggest barrier. That's what I'm getting here. Curriculum or guide to follow in order to provide structure with teaching nutrition. Ooh, I like that. If you could clarify a little bit that for me, Tiffany, do you mean like the nutrition that goes along with the cooking portion? Like if you're doing this set of recipes, what nutrition topics do you talk about in like a framework for covering all your bases, or just in general a curriculum for both the culinary piece and the nutrition piece? I'm curious if there's a difference for you there. Renata, what Joni said. Okay, great. Yeah, Joni said that really nicely. Big goal is to work with underserved populations. Yes, but a lot of people don't have the skills regardless of income. What's keeping me? Money and the business side of things. Money is a big one, right? There's a lot we can do with just a little. This is one I like to, I think, like where there's a will, there's a way, right? If you get creative, and we talked about this on the last call. So if you weren't there, if you were there, awesome. You already know what I said. If you weren't, you can go to YouTube, catch that replay. We talked about kind of overcoming our own self-imposed limitations or imposter syndrome, so to speak. And I'll probably bring this topic up a few times, but our beliefs of what holds us back. We want to challenge those. I'm not saying money is not a real thing that does hold us back, but we can still do a lot if you get creative with it. And I find dietitians and culinary medicine are really good at getting creative. That is definitely a strength of ours. Liz hopes to find engaging ways to get people to learn from the information in interactive and fun way. Love that. Fun is also a good ingredient here to make life changes for themselves and their families. Yes, life changes. Alexandra does not have a vision for what she wants for culinary medicine just yet. That's okay. That's okay to still be figuring it out. Even if you're like, this is an interest of mine, I can get into this. It will grow. It will flourish. Getting the education will be my biggest barrier right now. Ooh, okay. Yep, it does suck a lot of our headspace, that's for sure. Um, just reading through the rest of this. Okay, and there's a personal tie-in there too. That's all, honestly, I actually don't talk about that a lot, but I have a pretty significant personal tie-in too. All right, guys. In the interest of time, I want to read all of these out loud. I'm going to read them after the call. Please keep posting if you haven't put your response in the chat yet. I will look at them. I just want to be mindful of our time today, and I'm going to go ahead and press on to our educational portion here, just so we have time to get it all in. Um, but this chat is gold, guys. I love seeing your visions. I just can't tear my eyeballs away. Oh, someone said something interesting I want to say real quick. Aaron, is a barrier, commitment of those who are signed up versus no-shows. Oh, okay. So really maybe our marketing and positioning of the culinary medicine program to make sure we're getting people who are ready to commit and ready to make those changes. Love it. Okay, keep going, guys, in the chat, even while I'm talking, unless you want to listen. That's cool too. You can always pop back into the chat later. So our mini workshop topic for today is you don't have to do it alone. You don't have to be a one-woman show or one-man show or one-person show. I find in particular, dietitians often feel like they need to do it all, wear all the hats, and be the main force bringing this culinary medicine program practice to life. And to a degree, you're not wrong. We are really well positioned as these champions, and I spend a lot of my time advocating for the leadership of dietitians in this, but just that leadership, not soloship. Leadership. You need to be leading others too. You need to bring them into the fold. And that's how you become a leader, right? You guys are all already leaders, if I'm being very honest. You may not have just gotten to that point where you've actualized this. You're still positioning yourself, and that's okay. What I want to do is encourage you to step into that space. You are a leader, but in order to be a leader, there has to be other people to lead to a degree, right? And it doesn't have to all come down just on you. You're going to be a driver of this change for sure. You are a champion here, but it doesn't have to stay just you forever. You want to find partnerships, you want to make connections. This is how you grow, and this is how you are able to still accomplish more without burning yourself out, because that would be the worst. We need you. I don't want to see you burn yourself out on this. Success, long-term success, just like we teach in our classes, that sustainability piece, right? Long-term success, excuse me, comes from building systems and generating support. You don't have to carry everything alone. I'm going to repeat that a million times today. But that's the gist. So we're going to talk about how to identify your potential collaborators, building partnerships, creating that sustainability and impact, communicating the value of your program effectively to get some of that buy-in and interest, and marketing, right? So we're touching on the marketing just a little bit. That communication is key. This would be like your elevator pitch, so to speak. How to talk to physicians and other healthcare providers, setting up referral systems. So you get a stream of clients coming to you, or a stream of interested, ready to change individuals, right? And then how to engage leadership and secure organizational buy-in if you do work for an organization. Some of us here do, some of us here don't. I will say this piece, even if you have your own practice and you're going this solo, this is still important for collaborating with other organizations. So maybe you want a community partnership with your local farmers market or food bank or YMCA. The things I'm going to talk about in this piece can apply to that too. Pretty much any organization. All right. So what are we going to do first? Identify our potential collaborators. How do we know what we need? Well, those questions I just asked you can give you a clue. What do you envision for your program, for your practice? Who is involved in that vision? What does that look like? What is happening in that dream, in that vision of yours that you personally may not be the one to supply, right? I don't think it's all coming from you. You might be the creator, the orchestrator of all of this, but you don't necessarily have to be the one delivering every single facet of it. Last month, we talked a lot about identifying our own strengths and taking maybe a strengths finder assessment of some sort. I even presented the framework from Gay Hendricks in The Big Leap. That's a great book. If you haven't read it, check it out. In terms of identifying our zone of competence, zone of incompetence, zone of excellence, and zone of genius. If you've done that exercise, a really good place to start is your zone of incompetence. What are you not that great at? That would be a really great place to start. Or what is your program missing? That's also a great place to start to identify potential partnerships and collaborators here. So for example, I'll take some examples here. If you are a private practice, a really nice option for a collaborator would be a medical practice group, right? A group of physicians who don't have a dietitian, but who can see the need for the support in their clients and patients with diet-related chronic disease, right? So that would be a potential collaborator. Recreation centers, gyms, and things like that. Places and organizations that other people go to for any type of food, nutrition, health, wellness-ish thing, right? That could be a great collaborator. That would be a wonderful referral source for you. Maybe you're not good at marketing. Maybe you're really good at delivering, but marketing, you're just like, I don't even know what to say. I don't know what to do here. You could outsource and hire a marketer and maybe see if there's someone you could partner with. You could reach out to a local TV channel or radio station and ask them to do a bit. They are always looking for people to fill up their time slots. So you could probably get this airtime for free. So just try different things and try putting yourself out there. But this would be an example of a partnership. If you establish a relationship with some form of media entity or organization, they can help you market. Maybe you agree to do a program for a local rehabilitation organization, and that way they can market that program. They're marketing it to their population, but other people hear that too, right? The word gets out, things like that. So going back to it, I won't get too sidetracked. I can go down the rabbit hole of examples all day, guys, which is why this mastermind is going to be so great. Now, anyhow, identify what those weaker links are, or those missing pieces, or what you feel is even holding you back. That's why I asked that question earlier. What do you feel is a barrier for you right now, right? Go seek that thing out. Someone somewhere does it, and they might be able to do it for you for free too, if you present it the right way. That's kind of in one of the next slides here. So thinking about what would complement your own strengths, right? You don't need another you. You need someone who isn't you that fills in those gaps, right? So partnerships is the key to sustainability and impact. We can do a lot as one person. We sure as heck can. I don't really think there is a cap on what one person can accomplish or influence. However, historically speaking, one person doesn't do much without others, right? That kind of going back to that discussion on leadership. We need other people to lead if we're going to be a leader in this space. And it kind of comes to that to a degree. We might be doing a really awesome thing for the world. And when we partner with someone else, it's amplified. Our impact increases. We reach more people whom we want to serve. We rope more people into this culinary medicine cult now, this culinary medicine field, right? Our program also becomes more sustainable because now not everything is on our shoulders. What happens if you go out on maternity leave or get sick or get injured or just need a brain break? Go on vacation, right? things can exist beyond you. That's really what we want. Just like having a child, right? The whole point is that you create this person that becomes a fully functioning, independent adult, and they don't need you anymore. That's actually the goal, right? That's the same way with our programs to a degree. Now, you will always have a place. Don't get me wrong. It will never outgrow you to the point where you do not have a purpose to serve. But at the same time, for sustainability and scalability, there has to be some portion of it that exists outside you because you are human and you need to take care of yourself and take breaks too. that is part of it. Right. So recruit others to help. Recruit, seek out partnerships with other healthcare professionals. Like I mentioned, doctors are physicians, excuse me, physicians, but other healthcare providers too, like RTs, OTs, PTs. They all kind of interface with aspects of nutrition-related behavior. So there's ways you can support them. Students and interns, right? Maybe make it a mutually beneficial relationship where they get some education, but you get some support with certain aspects of your business or your practice, and you can focus on the stuff you enjoy the most, right? Existing programs. This is one of my favorite partnerships, something that already exists. It's so wonderful because all you have to do is come in and insert like a little slot of culinary medicine into this existing program. Bam, you have a whole new audience. They usually have their marketing already set up. There are people invested. And all you have to show up is do is show up and do your thing. That's one of my favorite things. And that is one of the quickest ways to grow your practice or program is insert yourself as a culinary medicine component into something else, a rehab program, a cardiac rehab program, a weight loss program, a employee wellness program, something out there, right? Just create a little snippet and put yourself in there. Extension services, practice groups, gyms, and local community buildings like even churches are also a good place to look for partnerships. Now, the next piece here, communicate the value effectively. I think this is also where a lot of us kind of trip up on ourselves. We know the value that we are offering here. We see that transformation. But we don't always have a great, like, quick pitch for people when we're explaining it. What I want you to do is create your elevator pitch, essentially. Identify the problem you solve, and then that's it. That's the pitch, really. The only other piece is your why, because that's a big seller for people. People want to know why you're invested and why they should be invested too. That's really it. That's it. So, and we've talked about this before. Reflect on that why. Reflect on why you're here, what you're doing. Everything you just shared with me in the chat is a wonderful starting point for that, right? Craft that nice little elevator pitch. Okay, now this next step is what I find people miss the most. You got to rehearse that bad boy. Rehearse it in the shower, rehearse it in the mirror, rehearse it at home, rehearse it in the car. Practice saying it over and over and over because it needs to be able to just come out, roll off your tongue. Easy peasy. When you see an opportunity to form a partnership, you get kind of, it's not one shot, but that first shot is your best shot. We'll just say it that way. Walk up, introduce yourself, deliver your pitch, right? That will begin the conversation or open the door for you. And then you can set up more meetings, more contacts, work out the details later. Get a good elevator pitch. And really and truly, it's silly, but it's not silly. You got to practice it. You got to be good at saying what you want to say to communicate that value. That's the biggest, like from what I see, that's one of the biggest holdups is people know they just don't articulate it in the right moment to others who could benefit from this program, right? So think problem, solution, why should they care? That's your elevator pitch, and then just practice the heck out of it. Talking to physicians. So I do see also there's some hesitancy in approaching physicians. Between healthcare providers in general, there's kind of a silo effect to a degree. And I won't really go into the cause and effect there too much today. That's a discussion for another time, another soapbox. But it exists. There is something there. There's some sort of social barrier. However, just remember physicians are people too. And we have to assume they are also here for the same reasons. They want to help people. They're helping people in different ways, but they still want to help people, specifically helping people overcome these diet-related chronic diseases that they see day in and day out. And they are not essentially equipped with the nutrition knowledge and background that dietitians are. Some physicians have sought that out as continuing education or specialties, yes, but they still don't have that core education like dietitians do. So this is our time to shine and present yourself as such. Don't present yourself in competition with them. This is not a competition. We all have a place here. Present yourself as an asset to them. Describe how you can help them. Remember, problem, solution, why should they care? Right? Approach them that way, invite them in, and actually invite them in. That's the next piece is maybe invite them to a class or invite them to shadow a session. When they get to see what you're actually doing, it changes the game because they'll have like this preconceived notion of what a dietitian does all day, like sitting in their office writing diet orders or something like that. Right? Like the lunch lady equivalent kind of thing. They might have that perception. A lot of people do too. A lot of lay people don't even really know the magic that we do with food and nutrition, right? We have to show them that magic. We have to show them that transformation, that experience people get from attending a cooking class or sitting through a session where we talk about culinary medicine and work through scenario-based nutrition education, right? Invite them to witness it and participate. Once they do, they will really understand and appreciate that value. You can re-deliver your elevator pitch. You can say that as much as you want. It doesn't get old. And then set up a simple referral system. That's the big piece here, the referral system, or some open communication channel. Something I really want to encourage you to do when you set up this system. I say system like it's going to be complicated. Maybe I shouldn't have used that word, but make it simple. Don't make it this convoluted 10-step process. Something simple. Okay, here's my email, or here's my fax, here's my secure message link, right? Something super, here's my phone number. Have some sort of maybe secure form that they can send information, some super simple way for them to refer people. You could leave flyers with them and they can hand them out to their patients or clients. Having a direct referral where they provide you the patient information, I do find to be best because there's still hesitancy on the patient side. They may know they need this, but there's fear and uncertainty, so they may not commit yet. If you do a warm outreach, they're going to be more likely to sign up. So I do like to get the information directly from the providers themselves, but just to make it easy, physicians notoriously don't have a lot of time to spend with their clients and they don't have a lot of time to spend on the in-between stuff, which is part of the problem with our healthcare system. Anyway, I digress. Make it easy, make it simple. They're going to be much more likely to take that action for you. And then, of course, if you want to take an extra step, you can also offer something customized to their population. So if you approach a physician that works in obesity medicine, maybe you can create a one-off class or a mini series specifically for that population. Last but certainly not least, we're going to use those same principles, but translate that instead of talking directly to a person like a physician or other healthcare provider, we're thinking bigger. We're thinking organizational level buy-in. And for what it's worth, if you're uncomfortable with doing this, start small. You don't have to go straight for the organizations if that feels intimidating. Pitch your elevator pitch to some real just individuals, doctors, OTs, your friend that's a doctor, whoever you feel comfortable with, practice it. Get a feel for it, get your feet wet before you jump in. If you're a jump in kind of person, do that too. But I'm just saying, you don't have to go 0 to 60. You just have to go 0 to 1. That's it. And then you go 1 to 2, so on and so forth. But when you are ready, organizational partnerships are a fantastic thing because they have more resources. They have admin staff, they have HR staff, they have marketing and media staff sometimes. They have more people with more different skill sets. So it's a wonderful thing. You're not just partnering with another individual. You get a whole collection of individuals that can now support you in different ways, little ways. They can take a lot off your plate. It's a great thing. And the best thing is, this is a mutually beneficial relationship, right? You're not doing this to take advantage of anyone. You are also serving them. And phrase it that way, win-win, problem, solution, why they should care, right? That why they should care, that's how it helps them. how it serves them. So when you're pitching this to organizations, still use your elevator pitch. It still works here, but you want to do a little extra prep as well as delivering your elevator pitch. So open with your elevator pitch. That often gets you a meeting with the decision maker in the organization. We'll say that. That's what the elevator pitch does. I would still re-deliver the pitch because it's a great thing and you practice the heck out of it. So why not? And a repetition doesn't hurt. But in your preparation, really think about how your practice or program, your proposal, so to speak, supports their mission or purpose. Tie it back to their big pie in the sky goal. Okay. If you can, map some of your key activities to outcomes. Executives tend to like to see numbers, impact, things like that. If you have previous examples, that's great. If you have examples that are not your own, like research papers, that is also great. See what you can do to just build a little bit of evidence, right? To show that this concept has efficacy. And even if you don't have like it's already happened evidence, you can draw the connections for them. Say, you have people that need this. Well, this is what I do, and this is how I do it. And by doing this, I project that will increase your population by this much percentage, or it will decrease the incidence of XYZ in your population by this percentage, thereby saving you money. No, going back to money does help, I will say. If you can save them money, they're all ears. But also, organizations, maybe like a nonprofit, they still care about money, but not to the same perspective there, right? They're more about the impact and the mission or purpose. So tie it back into that. How does this serve their mission or purpose? Think of long-term investment framing, not short-term outcomes. Those are great to throw in as little cherries on top, but the big thing is going to be in the long game. And again, deliver your elevator pitch. If you can, invite that executive to a class too. That kind of seeing is believing stuff is real. Once they experience that culinary medicine practice or program, they'll have a lot more buy-in because they understand what it is that you really do, right? And then from there, once you have that relationship established, even if it's not quite there yet, nurture it, right? Continue to foster that relationship, build that trust, just like you would with an individual. Follow up periodically, share wins that are relevant to them, or successes, or stats, or numbers, or impact once you get them, and just kind of keep an open dialogue. Check in once in a while, see if there's anything you can support with them with, what they're working on, what their, maybe their quarterly goals are, or their new annual goals, something like that. Keep that door open for yourself. But again, you don't have to do it alone, right? There's lots of opportunity for partnerships, for collaboration, and that's how we do more without having to necessarily become that ourselves, right? If it wasn't for partnerships, I would have to be, like my own media person, my own videographer, and I kind of am because I have my private practice right now and I'm growing my team again and forming new partnerships. But when I was in the VA, I would do this internally, right? The VA is like its own little ecosystem, its own little world. All of these things exist, but it's not necessarily easy to navigate still. But that's what I did. I partnered with a cardiac rehab program. I partnered with nursing staff and physician staff to help provide referrals and buy-in, to talk me up. I'd invite them to classes periodically so they could remember what it's like and remember what it is that I do, so they could then sell it to their patients and clients. So, take-home message. Well, I guess this is a question. I didn't start with a message. What could you accomplish if you had some support in your practice? And what does that support look like? Take-home message for real. Seek out partnerships that fill those gaps. You can't expand your impact if people don't know you exist. That's another big piece, right? Get your message out there. That's another reason for the elevator pitch. It just makes it easy to talk about. Even when you're just like meeting someone at the bus station, or you bump into someone you used to be friends with or went to high school with, or you're at home for Christmas and the conversation comes up, what do you do? Elevator pitch. It's impressive. When you practice that bad boy and it comes out smooth as butter, people pay attention and people really get it a little bit more than if you're like, oh, well, I teach cooking classes. That's what I used to say. And that just that just did not impart the magnitude or gravity of what I did for people. So let people know you exist. Put yourself out there. It's kind of like dating if you think about it, right? You're approaching people and asking for a relationship. And you know what? There is going to be some rejection. That is okay. That rejection, that should have been my take-home message. That rejection is not a reflection on you. You just do not fit their needs at that time. It is not the right time and place. That is okay. There is someone else that you can partner with and someone else you can serve that does need you. Just remember that. And at the end of the day, culinary medicine really is a win-win for everyone. Like, it's just a great thing all around. I can't really think of anything negative about it. I am biased. I will admit that very freely. So that's our take-home message today. All right. I'm really pushing this to the end of the call. Thank you guys for riding it out with me here. Self-empowerment reminder, because again, that's part of what I'm here for. Again, you don't have to do it alone. There is no shame in asking for support. Let me go ahead and clear that right up. It doesn't mean you can't do it. Doing it with help doesn't lessen your own volition, your own efficacy by any means. It really doesn't. It amplifies it. Amplifies it. And don't burn yourself out. Don't do that. We need you. Don't let it get to you like that. Don't burn yourself out trying to be everything to everyone. Stick with those zones of excellence and genius, and really the genius, because at the end of the day, that's how you're going to have a bigger impact. Doing it with help does not take anything away from you. It does not lessen you by any means. It does not diminish your own light. And it certainly doesn't make you incapable of achieving great things. It amplifies it. It really does. So thank you for being here. Thank you for sticking around. Don't go yet because we're about to do our drawing. So exciting, but I'll do it pretty quickly. For those of you who were here and attended, you will be receiving a certificate of attendance for half an hour CEU credit, and you get an entry in today's prize drawing. As a reminder, this is what's up on the docket, an ultimate teaching toolkit written by myself on behalf of the Teaching Kitchen Collaborative. It is not just my own expertise in this space, but the leading 6 largest teaching kitchen programs out there, and their best practices too. So it's a lot of wonderful information packed into a 100-page guide with resources. So very wonderful resource. You will be getting a digital copy of that. And every 3 months, I'll do a new drawing for a new resource. So next call, I'll announce what that will be for the next quarter. But today's the day. So if you showed up today, you're in the drawing. If you showed up in, July, June as well, you also get an entry. So every call you attend, you get an extra entry. This does reset every quarter just to keep things relevant. But yeah, we'll go ahead and spin that. Rowena has your names all listed in this spinny wheel app on the other side of the screen. I know you can't see it. I can't see it either, but she's going to spin the wheel and select a winner. Who is our winner, Rowena? Who's our winner? Erin! Woohoo! Yay! I wish I had the little confetti thing on my screen. I think Zoom will do it if I clap enough. Nope, no Zoom? Okay, it does it on accident sometimes. Is there a reaction? Can I do a reaction thing? Maybe not because I'm presenting. Well, hypothetical confetti. Okay, Erin, Rowena's gonna reach out to you on a private message, so keep an eye out for that and just get your information so we can get that to you. Yeah. Awesome. Well, that was exciting. At least I think it's exciting. Please keep tuning in. Like I said, we're going to do a new drawing every quarter, and every time you attend, you get an entry into that drawing. So there's always another chance to win, and there's some really nice resources. So next thing I'd like you to do, take just a little bit of action. If you can, share this call, please. Share it with anybody you know in this culinary medicine world. I would love to help more people and kind of bring everybody together in this nice, big, cozy family community. Join our LinkedIn Infuse community group. Speaking of community, I just discovered that was a thing you could do and created a group yesterday. So if you don't mind, go ahead and you could see this QR code worked. I don't know why. Go ahead and scan that QR code. It'll just take you to the LinkedIn community. It's like a Facebook group, but on LinkedIn apparently. So we can chat with each other and stay updated. Other big announcement. I see a few people are having to hop off. I know we are right at 4 o'clock. I'm so sorry. Next month's call will be September 23rd. It's not the third Tuesday, it's the fourth Tuesday. So just keep that in mind. I did have to change the date because I was unavailable on the third Tuesday, and I didn't want you to do the didn't want to do the disservice of like pre-recording content because I enjoy these calls and I wanted to do it live. So I did have to move it back 1 week. So September 23rd, that Tuesday, same time, same place. The link doesn't change. So if you're registered for the series, it is already changed in the series and it should reflect that for you. Just wanted to set that reminder. And that's it. Thank you guys so much for being here. I really appreciate your time and attendance and your participation in the chat. That was delightful. It's so exciting to see what you're all up to, and I really do get energized from this, guys. If you can't tell, I'm stumbling on my words now. I'm so excited. Congratulations again, Erin. I hope you appreciate and use some of the things in that guide. I make a bet. I would bet money. There's at least something in there you can find helpful. So, all right. I will see you guys next month, September 23rd. Take care, everyone. Go forth and do great things. Bye.